diagnose your condition first, and then we're going to treat your condition. I'm going to diagnose, and then we're going to treat your condition. I'm going to diagnose it, and then we're going to treat it. I'm going to diagnose it, and then we're going to treat it. Diagnose, then treat, diagnose, then treat, diagnose, then treat, diagnose, then treat. Okay, okay, good. Okay, good. Okay, good. Okay, look at me. Okay, good. Okay, look at me. Okay, stop looking at me. Okay. Now, I'm going to need you during the course of this examination. I'm going to really need you to concentrate. Concentration is key. Concentration is key during this examination. Now, if you are like Save Me Punk and you do not have a soul, do not worry. I can definitely find out. I can definitely find out what's wrong with you. Now, so some of the things that we can do to diagnose you is that I'm gonna just take a quick look. Okay. All right. Okay. I'll look at your face here. All right. I see. So it appears that you have two eyeballs here. One here. Okay. So we're going to be looking down here. We're going to be looking at those eyeballs. Okay. They seem good. They seem like they work. It seems like you are. Are you seeing me? Can you see me well? What do I look like when you see me? Can you see the flames behind me? Can you see that? I hope so. I hope you can. Now, what we're going to do is we're going to see all the features on your face. Going to make sure that we touch them. Don't be scared. You don't have to be scared. Mr. Buff is here, and a depressed minion. It is okay if you're unwilling at any point to have your soul removed from your body. That's okay. That's fine. You may depart the clinic at any point. You may depart the clinic whenever you wish. But because the clinic today, we're going to take good care of you. Good care of you as we remove your soul from your body. Okay. Now. What I want to do is, of course, palpate your face. Okay, that's good. That seems. Okay, yes. I will be ripping your soul from your body. We have to diagnose you first. Please, I am a professional here. Just have patience, remember. Now, remember, this is what you might call an intellectual decompression chamber. So where we have our skepticism and we have our disbelief willfully suspended to induce fascination. Okay, so okay, good. Okay, so look at me. Okay, look at me. Are you looking at me? Okay, now stop. Stop looking at me. Okay, don't look at me. Okay, so now, very important to the diagnosis and the treatment, of course, is my chalice. My chalice that I have. I know a lot of people prefer to have a chalice that is made of different materials, of course. But I only have this one made of glass. You know, as we are something of a back alley clinic, this is all we could afford. You know. Now, here we go. Now, when we are doing the treatment, you may be subjected to some certain stimuli. You may be subjected to some certain stimuli, and I'd like for you to know about that. You may experience forcibly through any method. Because if that's happened, I will need to know about that. That could be a pre-existing condition that we will have to make some adjustments for. If that happens, we will have to make some adjustments for that. Hello, forcing it is here. Hello. With this vibe, got the good Kirby vibes. Okay, so we have a few instances, it seems we have a few instances of demons, we have a few instances of ghosts, perhaps ghouls, perhaps spectres, that has tried to steal your soul in the past. And that's okay, that's okay. That happens sometimes, it happens from time to time, and it is not a deal breaker, it's okay. Okay, so as long as you are making sure to concentrate very closely, because your soul's connection may be a little bit weak. We don't want to just pull the whole thing out right away. We want it to be a gentle process, because otherwise you may not survive. And that's why we must be careful. So make sure that you're concentrating. Make sure that you're concentrating with utmost concentration. Concentrate with concentration. That's what you must do. And now, okay, so I'm going to do a little bit of a test. Do you see my ghostly doctor's material, my ghostly my ghostly material? I'm going to be piercing your face. With this, and I believe it will cause a sensation. It will cause a terrible sting. When I touch your face, it should cause a terrible sting. If you feel a terrible sting, then you know that it is working correctly. So if I poke your face and you feel a terrible sting, that's completely normal. And please let me know if you do not experience a terrible sting. Okay, so here we go. Okay, there we go. I'm gonna touch. Okay, yes. Do you feel that? Do you feel that when I touch? Do you feel that when I touch your face? Are you bleeding profusely? Do you feel a terrible sting when I touch your face? You should. I hope that you did. And if you didn't, it's okay. Just let me know. And I'm sure that we can find something that causes you to feel pain in the way that you need to. Now, I want you to look. I want you to tell me how many fingers I'm holding up. Okay, this is a fairly routine exercise, alright? You might see this at a real doctor's office. You know, those folks, they're always so high and mighty. Now, so tell me how many fingers I'm holding up. Can you tell? Look at me. Okay, stop looking at me. Okay, can you tell how many fingers are being held up right now? 2. Okay, very good. You got it. That was very good. Now, how many fingers? This one's harder because it's a higher number. You might have to count a little bit higher. Okay, forcing it has gotten it. It is 3. It was 3. You did a great job. With that. Thank you for doing a great job. You did a great job counting those. You did a great job counting. You did such a great job counting. You did such a good job counting. Thank you very much for counting. You did a great job. Now I'm going to use the other hand. And you're going to tell me how many fingers I'm holding up. Tell me how many fingers I'm holding up right now. Now it's sideways. That might create a little bit of an issue for you. Because it's sideways. But if you can still count it, then it's okay. Follow the finger around as it moves and count them. Follow the finger around it. Follow the fingers around it and then count them. How many fingers am I holding up? 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 How many fingers do I hold? How many fingers am I holding up? How many fingers? I said, how many fingers is it? How many fingers is it now? Is it a different number? Has it changed? Is it a different number of fingers now? Is it a different number of fingers? What's the number of fingers? How many fingers am I holding up? is that before we begin the process of removing your soul, you need to be in a very fascinated state. You need to be in a fascinated state where you are really, really concentrating. And that may be difficult. It may be difficult to achieve that. And I have a method. I have a perfect method for inducing this state in you. So if you can do some calm relaxation. If you relax yourself, relax. As long as you're looking at me, as long as you maintain eye contact, but relax. But look at me. But relax. Looks at me. Make sure you're looking. But relax. Very good. I'm glad that you are drifting. That is a good state. If you feel yourself drifting off, that means that the treatment is working. The chemicals that we are applying to you right now, the chemicals that are being injected into your room in a gaseous state are working. And that's good. That's a good thing. It's a good thing to have. Now, what I'm going to do is I'm going to say a word. And I may say this word later. I may say this word throughout the video. I may say this word, and I want it to resonate in your mind. I want you to think about it. When I say this word, I want you to hear it. I want you to hear the word, and I want you to focus on it. I want you to focus on this word. When you hear this word, make sure you are focusing on this word that I say to you. Okay, now this is going to be very important for inducing you into the state that you need to be in to remove your soul. And that word is going to be sink. Where we're going to make sure that you sink into a deep state, a deep trance, right? So make sure you remember that. When you hear it, it's very important. Listen to the sounds of it. Listen to the that sound. It pulls you away. Sink. Okay. Now when you hear that, that is your cue to focus. That's your cue to focus. That is your cue to focus very closely. When you hear sink. Okay. So make sure you are focusing. Deeply and intently, because I just said it several times. It's already started. The process has already started. Now that you are here, now that you are focused, what I want you to do is that if you feel the urge at any time to close your eyes, you will have permission to do this, okay? You have permission to do this. If you don't, it's okay. But what I do need you to do, the thing that I do need you to do is relax. Okay. Sink. That was a test. That one was a test to see if you were paying attention. Now, if you are focused, if you're looking at me, don't look over there. Look at me. Don't look over there. Look at me. Look directly at my face. Look at my face. Look at my face. Don't look over there. Look at my face. Okay. Very good. I'm glad that you're being intent. I'm glad that you're intently watching. That is a great thing. That is a wonderful thing. That is amazing. I'm very proud of you. We are going to have to make sure that you are breathing in and out, and that you are thinking relaxing thoughts, thinking about things that make you happy, like the screams of others as they wail in pain. Sorry, that's more personal. That's more for me. Think of things that makes humans happy. Whatever makes you humans happy. Think about that, okay? Something relaxing like that would be great. That would be great to think about. So just think about those things. Think about those things as you relax. And you get into a deep, intense state. A deep trance-like state. Okay. memorize these words. It's okay. It's okay. It's okay. Just relax and sink down deep. Sink down deep and don't think about the words. Don't think about the words. Think about the sounds that are coming out. Think about the sounds that are coming out that are being made by the words. Even if you don't understand them, okay? Even if you don't understand them. Now what we're going to do is we're going to have you close your eyes. Close your eyes if you want. If you like the visuals, you may keep them open. But otherwise, close your eyes and sink down. Sink down. Severance. Yes, we can add a little bit of tapping here if that will help you get into a real relaxed state, of course. Now, as we are going and as we are severing your soul from your body, make sure that you're remaining relaxed, that you are in a state of please listen to the sound of the on the glass. It's a very light sound that has been going out. Now, it's not something you need to worry about. What happens to your soul after it leaves its body? That is not really that important. What is important is that we are taking it away and we're going to store it in a very good place. It's going to be in good hands. Don't worry about it. And what's most important is that you never have to see it again. It's okay. You don't have to ever worry about that soul bothering you ever again, okay? That soul will be something that does not need to be concerned. You don't need to concern yourself with it. You don't need to think about it. You don't need to worry about that soul anymore. Once it is taken away, it's going to a better place. Well, maybe not a better place, but a different place where it will be taken care of. And you can keep your body afterwards. You are free to keep your body. I mean, a lot of people tend to go for a very long time without their soul, so you don't have to worry about that too much. You can go ahead and keep your body. Really, it's not much use to us for our purposes after that anymore, so you'll be sure to have your consciousness. I'm sure you'll have your consciousness. You know, these are lots of very important questions, but it's okay. It's okay. Look at me. Okay, stop looking at me. Look over there. Look over there now. Alright, look over there. Now look at me. Look over there. Look at me. Look over there. soft, very soft. Listen to the soft sounds of the mic brush. Soft, soft sounds. Soft sounds of the mic brush. Very good, very good. If you are feeling like drifting off to bed, drifting to sleep, that is very okay. We can perform this procedure in your sleep, and it will be done by the time you wake up. If it will be done by the time you wake up, you don't even have to think about it. If you are asleep, this procedure can proceed as normal. In fact, you being awake is primarily the deterrent that prevents us from truly accessing your soul. And when you are awake, your brain has all these thoughts, sink, just like in Get Out. Just like in Get Out. You're going to sink down, and you're going to be in a relaxed state. You're going to sink down, and you're going to be concentrating to the point of fascination, where you are thinking about the sounds of everything that is happening. You're thinking about the syllables of the words, not the words themselves. You're thinking about, when I say something like sink, sink, you're thinking about the s, and you're thinking about the k, and you're not thinking about the word sink. The sink word means nothing anymore. It means nothing more. this area and allow me to pluck them. Allow me to pluck your thought right here. Now, if you don't have any thoughts, and your head is empty, what you need to do is just relax. We have lots of patients here.